the president and CEO of the Brockville General Hospital, Nick Vlacholias, is with me, and we're going to talk about COVID-19 and so much more. So let's welcome Nick to the program and talk. Nick, welcome to the program.
Thank you, Doreen. Glad to be here.
So, Nick, please tell our viewers, if there's a relative of theirs or someone that's in the hospital and they want to come and visit, what is the protocol for them with reference to COVID-19?
Well, first of all, you have to register as a visitor through a mechanism we have, the details on our website. And we have two components. One is what's called an essential care partner. And we also have general visitors. And we do have some rules and restrictions around that. But essentially, if you register and you are vaccinated and or if you need a negative test, and that's only up to October 31st. So after October 31st, visitors and essential care partners will need to be vaccinated.
Okay, and what is the policy at the hospital for the employees and or contractors or whatever? What is the policy there?
So we have a two-step process. Directive number 6 that came from the Ministry of Health or the Public Health of Ontario indicated that we need to have a vaccinating test policy. And so what we've done is that right now, employees, contractors, and so forth need to be either vaccinated or do regular testing. And that is up until October 31st. Because we've issued a mandatory vaccination policy for everyone that comes into this building, including our employees, our staff, our contractors, our medical staff on top of that. So everyone has to be fully vaccinated by October 31st. So in order to do that, you need your second dose by October 17th.
Okay. And does this include, I believe there's some off-site locations that are under the umbrella of BGH. So it includes those sites as well, right?
That is correct.
Just wanted to make sure that we're all on the same page. So currently, are there any COVID-19 patients that are being treated at the Brockville General Hospital?
Fortunately, no. We have no patients at all. And again, this is a tribute to the community. We have one of the highest vaccination rates, we have the highest vaccination rates in the province of Ontario. So we should be proud, and vaccinations work. And we're not seeing lots of patients coming in through our doors at the hospital. And that also protects healthcare workers, your loved ones, your neighbors, and your friends.
Yes, it does indeed. And Nick, the Delta variant, as I was talking with Dr. Stewart about that, and yes, it's here. It's here. But you haven't seen anything at the hospital, have you?
Well, when we actually do the testing, we just test for the virus, and then also the public health will actually test what type of variant it is. Mm-hmm. My understanding is that Delta variant is the most dominant, so your high probability when you're affected with COVID, it is the Delta variant.
Okay. So there again, the mask, social distancing, as well as washing hands are still mandatory, are they not?
Definitely it is. Yeah. When you come into the organization, you have to have a mask on, and we do have the physical distancing, making sure people are 6 feet apart. And we have hand washing stations everywhere throughout the hospital.
Good. So let's talk volunteers. Are they back yet?
The volunteers actually have been back for at least the past 6 to 8 weeks, I believe. So they are, it's awesome to see them with the smiling faces through the mask, obviously, and the smiling eyes. They've been incredible support to the organization. And it's really nice to see them. And as of yesterday, we actually did the grand opening of Eleanor's Cafe.
Whoa.
So the new Eleanor's Cafe is located just right inside the new building of the Donald B. Green Tower. And as you're walking towards the older section of the hospital, and it's really nice to see them there. And it's wonderful. We're trying to get back to a little bit of normalcy, and having the volunteers back is exceptional.
That's nice. That means that, things are a little bit better than what they used to be. So what about the gift shop? Is the gift shop open yet, or is that something that's being worked on and planned for at this time?
We're having discussions with the Volunteer Association at this time. So the gift shop is closed, and we are having those discussions. We're hoping we can open them up, but we also have to be extremely careful that we don't want people to congregate in certain areas. And so we're having those discussions.
And I can see that the gift shop would be. You have to be very, very careful with people going in and whatnot. Let's talk about the health information system. I understand that there's a new system that has been implemented. Could you tell our viewers about it, please?
It's actually in the process of being implemented. It's going to take us quite a while, so
Okay.
that's okay. So when I joined Brockville General Hospital back in 2017, there was discussions about having a common health information system with the 6 hospitals in the Southeast. And that is Quinte, which is Belleville, Bancroft, Picton, Trenton area, the Napanee Hospital, Providence Care from Kingston, Kingston Health Sciences Center from Kingston, ourselves, and Perth and Smith Falls Hospital. And so those are the 6 partners. And what we've done, we actually have gone through a process of selecting a health information system so we can implement. So we have launched that effective June, and we're starting the planning of it. It'll take us 3 years to implement across the board. But once it's implemented, we will have the same information system, and we could share information amongst each other, given that we do transfer patients to and from. And that information will be available, subject to all the rules and regulations around personal health information.
Yes.
But we'll be able to standardize our process across the 6 hospitals. And it's wonderful.
Yeah.
And I think what's really important is that patients will be able to see their information through a portal. So if you want to get an update on your lab values or your pathology values, again, there's going to be certain restrictions.
Yes.
And around that, but you will have access to your information via a portal. And that's what one of the most exciting components is around the health information system, is the sharing of information with patients.
Which is it just with patient, or would it also, I'm thinking of, and you just mentioned it a bit, would be someone that's being transferred from Brockville to Kingston or wherever, and that information is readily available to the specialists. Is that something that
is correct.
Oh, good. Good.
That's one of the most important factors.
Yes.
Is that the sharing information reduced the repetition of tests, and they also can see patterns within. Lab is one that comes from a laboratory test. So that's the intention is to have one common system across the board. And now we're engaging all our staff in it, and it's going to take us 3 years. So just ask you to be patient with us for the next 3 years.
But I think it's great that we're seeing this happen. It's happening now. Yes, it's going to take 3 years, but within that 3 years, there's going to be some learning, as well as, anything that has to be tweaked can be tweaked. And it's going to be a fantastic system in 3 years' time, because we can share. We can share, and it's readily available. So,
and the intention is where we can expand. And I use the example of primary care physicians. If they want to have access to the system or use the system, that's going to be available to them in the future. Once we solidify the hospital system, we'll be able to share that system with others and have one fully integrated system across the board. But that's going to be 3 to 5 years away.
Okay, well, that time goes fast, as we know. Let's talk about surgeries, Nick, and the wait times. Are the wait times becoming much better than what they were during COVID? Like, are we seeing many more surgeries that are happening right across the board?
Well, what we can safely say is that we continue with our surgical volumes, and our wait lists are coming down slightly. But there is a significant backlog across the province of Ontario, and we want to catch up. The province has made an investment here for medium-sized hospitals, which Brockville General is one, a separate investment to expand surgical volumes. And we're in a process of looking at that. So in the future, you'll see that the hospital ourselves want to increase the number of surgical procedures, cases that we actually do. So there's more to come on that, but we're working on some plans to see that expansion happening.
So, Nick, is there a possibility that we might see cataract surgeries on weekends? Is that a possibility?
Yeah, well, there's always options like that.
Yes.
We haven't solidified the weekend work. We did that before in January, February, and March, and we were fortunate because then wave 3 came really hard in April and May, and we were ahead of the curve, you could say, compared to other hospitals. We actually did a lot of cases on the weekends, and given that the wave 3 hit in April and May, and we just wanted to recover a little bit in the summer months, give staff some time off. And now we're gearing up to look at doing additional procedures and cases.
Oh, that's great news. And it's great for our viewers, I'm sure. Is there anything else that you would like to inform us about the Brockville General Hospital and what is happening there?
No, I just want to thank the community for their support. I mean, it's been significant, and there's, we're doing what we're supposed to do, and we're very thankful. I mean, if you look at our vaccination rates, I rave about that. I brag about that. We do an exceptional job, and we should be proud of that. When you're hitting almost 94% for first dose and almost 90% for second dose. There is no other health unit that will probably ever catch us because we're doing so well. So just keep up the great work and thank you for your support.